what a great question. And it's a question I often see in support groups, and I also see people say, go get a second opinion often. I even say it. But is it that simple? Especially when it comes to pathology actually being taken but coming back as inconclusive or fibrotic, and it never counts as a true diagnosis. Let's talk about it. Endometriosis isn't just a reproductive disease. It's been found in the lungs, brain, skin, even the adrenal glands. But most doctors, they're still only taught to look in the pelvis, and only if you have a uterus. This is rooted all the way into med school education. If your surgeon isn't trained to recognize endometriosis properly, the pathology lab might not even get the right tissue. And even if the surgeon does get the right tissue, recognizes it himself, and then gets it to the pathology lab, but they don't do something right, or they don't realize that lesions can be too small, degraded, we begin going misdiagnosed, or, if you will, under the radar. Skilled pathologists can actually identify if endometriosis was there, or if it's gone under any further manifestations, including atypical manifestations. It's like a fingerprint. But the thing is, the people who can actually recognize those fingerprints within pathology, all the way over to the surgeons who get them the pathology, if these two groups of individuals don't have the correct knowledge or even the skills to recognize or break things down further, you get the result that's showing right now, which is multiple misdiagnoses and multiple individuals not being seen, not having their pain recognized and taken seriously. How can you get a serious second opinion? You can ask a few questions. The specific one would be about excision versus ablation. Excision is actually cutting into the layers of the tissue where endometriosis is found and actually removing it that way. Now, excision can also be done with ablation burning methods. Ablation is burning it right off the top layers, and it often leaves behind carbon deposits and scar tissue, which is just nasty to deal with. Again, excision can be done with ablation skills, but it depends on the skills of the surgeon. Again, a precisional excision surgeon is what is truly needed. Excision surgery can be attempted by anybody, but making sure that there is precisional work at hand being done, that's what truly matters as well, because then we're not going to be getting small lesions that might not be picked up in pathology. We might not be getting damaged lesions that pathology can't recognize. There are levels to this recognition that we are lacking on a global level, which is releasing a chain reaction of misdiagnoses and patients left wondering, WTF? If you end up getting a pathology report, make sure you get that pathology report. You can take that on to whoever you go to your second opinion. If there's no pathology report done, but they said that they took samples, just red flag. Definitely go seek that second opinion. Another basic question would be asking their basic understanding of endometriosis. If they still think it's the uterine lining, keep on looking. And then also ask how long they have actually been treating endo. Truly skilled precisional excision surgeons have been working for a few years. Of course, there's going to be new doctors and new surgeons every day, and there's always going to be new gynecologists. But there are further training avenues that could be pursued to help build their career and their knowledge, which also should be looked into and asked in part of your questions, specifically in endometriosis care. Also, ask them what complex or difficult endometriosis cases were they involved in. The harder, the better. They obviously can't give you too much detail on the specifics of the case, but they can tell you their expertise and their experience and where they might not feel comfortable working. If you're concerned about having thoracic involvement and you go seek a specialist and they say that they only work around the bowels and the reproductive system, maybe start doing some more research and trying to find somebody else. And make sure you find out if they offer or recommend any post-op support and for how long. This could be like pelvic floor therapy, pain management, and even just regular check-ins with your surgeon. Now, there are a few trusted directories that are available to guide you along your way to finding either your first opinion or your second opinion, maybe even your third or fourth. If you're in America, Endometriosis Project is one really good resource that is working on actually communicating with the patients and the surgeons and making sure that they have these certain skills like we kind of discussed in the previous questions, and offering them a list as a easy to find reference. We also have icarebetter.com, who also does this, but they offer video vetted or non-video vetted, and they also offer a range of different specialists such as the pelvic floor specialist as well. I do think the Endo Project has a few of those as well, but it's still building, it's still fresh. Thankfully, we are hearing about other resources that might also be building their own little references and lists to be able to guide our community. The more the better. And then we have the yellowhub.org, which has a bunch of different tools that can help guide you as a patient and also looking for a specialist. These range from gynecologists, also some of the surgeons that are recommended from Nancy's Nook, which is also another list that is going around as well that's recommended. So the yellowhub.org has some of her list, as well as patient recommendations, and then just some of what she knows in general. And again, they are all general patient-based knowledge, which is also good to hear kind of from the community, from that community base. A good surgeon is going to have a good multidisciplinary team, which would include a good pathology team that are able to read their samples that they end up taking out. With endometriosis being found in all 11 major body systems, I don't understand why many of us are still being told that our pain is normal, and we're just being misdiagnosed altogether. It just doesn't make sense. Not to mention the group of others that are going undiagnosed under the radar. And when I say others, we're talking men, trans, non-binary, intersex, postmenopausal, and fetuses and children, and even animals. Crazy, right? I talk about it in one of my recent articles, and I also have a great Endometriosis 101 guide as well. Check it out over on theinvisiblevoice.net. You will also find many of our other columnists who are beginning to open up their invisible voice journey and speak out on some of the important factors that take place in the chronically ill and invisible illness community. You deserve answers. You deserve proper care. You deserve a provider who sees not only you, but your pain for what it really is and takes it seriously. And if they don't, the doctors work for you. You can leave, never come back, and go find somebody else. Protect your body, protect your soul, get your second opinion. Talk to you guys later.